Thank you all for coming. I realized when Peter Tibby gave his performance why we decided to have it at the Performing Arts Center at the college. He warned me that it was going to be interesting, and definitely it was. I also want to extend my thanks to Dale and Beth Black, because really the success of this program has really depended on their constant nurturing and care of the program. As you can see, I selected the topic of elements of a successful patient blood management program. If you went around the country and examined patient blood management programs, each program would be unique. And the reason it would be unique is because of the people involved and the culture of the organization. But ultimately, successful patient blood management programs have to have some elements to them that are fairly common, and those are the things I'm going to discuss tonight. So where do you start? You always start with a definition, because when you have a good definition, you know basically what you're trying to achieve. And you also know how to establish metrics that you can measure and say, yes, this is a successful program. So we made the decision early on to embrace the definition from the Society for Blood Management, and many of us are members of that society. If you read the words up there, and it looks like you can't see the top of it, but basically it's the timely application of evidence-based medical and surgical concepts designed to maintain hemoglobin concentration, optimize hemostasis, and minimize blood loss in an effort to improve patient outcome. The first thing that catches your attention is the word transfusion isn't even mentioned. This isn't really a program about reducing transfusions. It's a program that attempts to conserve a precious resource. It's evidence-based, which means we comb the literature and use the literature in making our decisions about the program. And the other thing that's important to remember is this isn't a surgical program, it's a surgical and medical program. So we look at the entire scope in which patients may receive blood and try to optimize the management of those patients. I take my slide building skills from Steven Seagal movies. They're always 2 or 3 words long, and that makes it really nice and concise. Of course, the problem with that is then I have to remember what I'm trying to say on each of those slides. Executive buy-in, I chose these words pretty carefully because what happens in the hospital system is a new program is suggested. Well, what happens is you present that new program to the executive team, and you make a decision based on the presentation whether you're going to go ahead with it or not. But that's not the element for success. The real element for success is when the executive team takes ownership of the program and leads the charge. Well, 3 years ago, Dr. Tibby and Dale Black presented this program to our then CEO, Tim Barnett. And it was an easy sell to Tim for 2 reasons. Number 1, it improves patient outcomes, which is critical. And number 2, it actually reduces cost. Most new hospital programs in this day and age cost a fortune to get up and running and rarely ever save cost. But when you've got a program like patient blood management, it does just that. So the decision was made to go ahead with the program, and then Tim assigned the build and launch of the program to Larry Burns, our Chief Operating Officer, and Diane, who helped introduce me back there. The one thing Diane didn't tell you is she spends a good portion of her time trying to keep me under control, and my guess is she succeeds somewhere between 10 and 20% of the time, depending on the day. But Diane and Larry both took this initiative. They bought into the program because of the value it brings to the program, and I'll talk a little bit about value. But they really led the charge. They organized it. They were visible throughout the development of the program, and that really is important. That's sort of an example of executive buy-in. If you go to our cafeteria and you look up at the large monitor screens that we've got down there, one of the slides projected specifically describes our patient blood management program. That just gives you some idea of the buy-in that this facility has for this program. Now, I'd say we have a secret weapon, but Dale Black is no secret. Dale's enthusiasm for this program is really infectious. He really brings people into the program with what he does. And he manages the day-to-day operation of the program. And without that, the program's going to lose direction and it's going to lose focus. And so I think it's definitely an element of success that you have a Dale in your program. However, as hard as Dale might try, he's going to have a hard time getting physician buy-in. Physicians are a peculiar group of folks, believe me, and the only thing that gets physician buy-in is other physicians. We were extremely fortunate at Yavapai to have Dr. Tippy come on board. He's been a nationally recognized leader in patient blood management for cardiovascular disease. And just as Dale came to each of the departments and committees and even to our executive committee to talk about the program, Peter took the time to present to each of the medical departments and to the medical executive committee. And that kind of physician champion is an essential piece of the puzzle. He continues to show great leadership in managing this program and has been able to bring other physicians on board, as you can see from tonight's presentation. It's really a critical part of the patient blood management program. And quite frankly, you're literally asking physicians to change their prescribing habits. There's only one way you do that, and that's by speaking to them as a physician and then leading by example. And Peter has done that since the beginning of the program. Our hospital staff, they're very busy people. They're dedicated to providing the best care that we can possibly deliver at our hospital. It's quite easy to get staff buy-in. All you have to do is explain the program. Value is an important concept in healthcare, and value is really outcome divided by cost. If the outcomes improve and the cost goes down, it's a value-add program. And if you explain that to staff and you explain that it's going to be evidence-based, you get buy-in right away. And we've got a very good team of folks, both nursing and lab and quality improvement are very actively involved in our program here at YRMC. You can run a patient blood management program without an electronic medical record, but the challenge of that is you're looking at paper records. The records are stored in one location, and you have to read physician handwriting when you're looking at notes and you're looking at orders, and good luck with that. And so we've had an electronic record at our hospital now since 2012. Everything is digitalized. It makes it a lot easier to capture the data and to put it into a format that can be reviewed by the medical review team. So we have a computerized physician order entry team of which I am a member, and we actually build out all these order sets. And we built out the order sets for blood transfusions. And what we did was we added a required field that the physician has to fill in when they order blood transfusions that explains the reason why they're giving the transfusion. So when we go back and review the charts, we have an opportunity to figure out, well, what was the rationale behind this transfusion? Now, you're going to get some griping when you do that because it's an extra click. And believe me, the clicks in the electronic record have driven the medical community crazy. But it also gives pause to consider, is this an appropriate use of the blood products? We spent a lot of time building a comprehensive library of our own. The Society for Advancement of Blood Management has a very nice collection of literature, but we've got our own collection. We all contribute to it. Dale manages it, and we use it regularly to decide on what we're going to use for our criteria to judge the appropriateness of transfusions.